Hi everyone, my name is Elle Irvine, and last year I was given the opportunity to share my experiences as a mental health patient for the Australian College of Mental Health Nurses Conference in Cairns as a keynote speaker. As an advocate for mental health awareness and a passionate believer in the eradication of stigma and judgment for mental illness, particularly within the healthcare sector, I was absolutely delighted to be given the honour of sharing my perspective with so many people. In the lead up to this, I may have mistakenly promised a number of people that I would ensure that my presentation was recorded, and I didn't, so that's why I've recorded this video. This video is the speech that I shared at the conference with a few small changes to make it moderately more appropriate for a wider audience. I would like to add that this speech was written with an expected audience of predominantly nurses and also other people working within healthcare, so there may be content that is stressful or triggering, particularly to patients of mental health or family and carers of mental health patients. This includes, is not limited to discussion of eating disorders, self-harm, suicide, trauma and PTSD, and also stillbirth. So I'd really like to advise people to just take caution before choosing to watch this video. Please decide whether you're in the mental headspace to be able to cope with it. If you feel you're going to be triggered, please don't watch it. Please don't put yourself in any danger. So I've spent a lot of time in various hospitals being cared for by mental health nurses, and during that time, especially as I move closer to recovery, I've been so fortunate to observe the practices of nurses that I just have the utmost respect for. I'm so incredibly honoured to be able to share with you my experiences inside the system, to reflect how negative experiences can hurt people in my situation, and more importantly, the life-changing difference that can be made by every amazing nurse who works with us to create a feeling of comfort and hope to support us and to ensure that their patients are able to thrive. My background is quite complex. In about 12 years, I've had ECT, TMS, EMDR, CBT, DBT. I've been on general wards and eating disorder programs. I've been in private hospitals and public hospitals. Been in PEC and on medical wards. This is because I was diagnosed with an eating disorder, depression and PTSD when I was 14. By this point, I was also self-harming, and I attempted suicide when I was 15 and spent a few weeks in public hospital. This was the first time that I truly experienced the stigma and the judgment that really made me feel less than human, and it came from medical professionals. I'd been moved to a paediatric ward, waiting confirmation of my transfer to a specialist eating disorders clinic in Sydney. One of my nurses came in during the night. She leaned in really close to me and she told me that I didn't deserve the bed I was lying in. She told me that there were other kids who needed treatment and had never asked to be in this position. If I had possessed any self-worth or assertiveness at that time, I would have told her that I never asked for my trauma, I never asked to develop PTSD and depression, and that my suicide attempt was an effort to lessen what I perceived as my burden on others, and I really didn't want to be in a hospital bed any more than she wanted me to be. I didn't need somebody to tell me that I wasn't worthy. I already felt that way myself. Nevertheless, it really hurt. It overshadowed a lot of the positive things that I'd heard from other nurses, and there were a lot, but it has become the one thing that sticks out in my memory the most. It actually made me quite wary of health professionals. I think it's it's a little like, you know, if you get a new haircut or a new shirt or whatever, you secretly worry that it's really awful, but you show, say, 6 of your friends, and even if 5 of them tell you that it looks great, really suits you, they love it, whatever, it only takes one person to agree with you that it's awful to convince you, if that's already your secret suspicion. So this is, it's a reflection of the confirmation bias, but unfortunately I can't look back on that as an isolated incident. It was merely my introduction to the stigma and the judgment that often comes with a mental health diagnosis. So I just turned 16 when that happened. It was my first mental health hospitalization, and obviously at that age I was still in high school. So I'm now 27. I got my bachelor's degree in photography, majoring in photojournalism in 2013, and I spent several years working on a photographic portraiture book called Immeasurable to raise awareness for eating disorders, which I have subsequently self-published. This is what the book looks like, for those of you wondering. If you want a copy, it's available on Amazon. I have 1 year left of a nursing degree, and I spend a lot of my free time doing work, volunteer work as a photographer for an amazing organisation called Heartfelt, which provides families suffering the tragedy of stillbirth or infant and child loss with a professional photographer to capture the last, and for some people, tragically, the only time spent with their children. And I'm also still predominantly an inpatient in a private mental health clinic in Brisbane. I now do maintenance ECT and sometimes EMDR to overcome the effects of complex PTSD with my 2 doctors, my psychologist, and a veritable army of nurses, both amazing and not. Sometimes I still have people telling me that I don't deserve treatment, that other sick people didn't ask to be in this position like I did. It means a lot less to me now than it once did, because I have the support of such a great treating team and have actually made a huge amount of progress, and probably more than I ever expected to make. But in the past especially, those comments were a really huge blow to me, and they did affect how I thought about my ability to recover and my willingness and ability to let people help me when I needed it. So I'm not from Queensland. The first few years of my treatment in Brisbane after I moved here were a little fraught, both for me and those looking after me. A lot of my treatment was not entirely voluntary, and to that end I spent a fair bit of time sitting in on tribunal meetings, fairly begrudgingly acquiescing to the professionals who stated that I couldn't be trusted to make my own decisions regarding treatment because, if left up to me, they stated I simply wouldn't have engaged with any of it and probably would have died. There was a lot of times when I was really irritated about it, and not because I felt that it was a violation of my rights, but because I didn't really feel human enough to deserve any rights and to have all these people working on me or working with me. Thankfully the doctors and nurses saw things quite differently, and I suppose that's one of the things that I really want to stress to professionals working in mental health. A lot of the time we ourselves do not believe we're worth being treated with basic human rights. You might have to believe it for us until we can, and believe me, it shows when people believe in you, especially if you've had experiences where people haven't. Sometimes all it is a look or a tone, but when someone shows you that they really believe in you and your ability to get better, it's one of the most amazing gifts that you can give to a mental health patient. Unfortunately, you are going to have to fight against people working in the sector there's some people who actually go out of their way to make people like me feel bad, feel more guilty, feel like we don't deserve treatment. Most of those people, I would argue, are unlikely to have a lot of understanding of the complexities of mental illness and a closed mind that helps them to decide they actually don't want to know, really. And if those same people have a bit of countertransference going on, maybe they've had a past experience with mental health that was negative, they allow themselves to get angry and really angry with those patients they see presenting with mental health issues. They treat us as basically attention-seeking time wasters who are stopping them from treating their real patients. This type of stigma and judgment, it steers people away from seeking particularly emergency treatment, which in turn leads to increasingly severe consequences from self-harm and suicide attempts, eating disorders, etc. I happily agree that not every mental health presentation to the ER is warranted, but I would also argue that for many people, getting desperate enough to go there signifies that something is very wrong and should be treated accordingly. I personally get fairly consistently berated for my ability to downplay an injury and avoid treatment for far longer than I should. Some of that is straight up stubbornness on my part, because I like to pretend that I don't need anyone or anything. Some of it is about fear, because I've been treated quite badly in the past. By going to a doctor or a hospital, I immediately feel incredibly guilty for taking up somebody's time with my problems, and I would just so desperately like to be able to deal with them on my own, but there often usually comes a point where I really can't safely deal with it on my own, usually because I don't own suture material or adrenaline. Also because after years of treating my body so badly, I have a history of cardiac problems, but they do get worse quite quickly now, because I spent so long just treating my body badly. So turning up to a hospital for these problems is frankly, it's pretty terrifying for me from the moment that I get into an ambulance and extending right out to the minute that I get discharged. I feel like I'm risking a lot because I know that I'm medically compromised beyond my ability to treat myself, but I feel very vulnerable in asking for help. A lot of that is learned behaviour because professional stigma is incredibly common for mental health patients, and I've experienced a lot of it. And that stigma is partly because of the lack of available resources and partly because of the lack of education and understanding for frontline physicians. Being a university student in nursing at the moment myself, I've noticed that the majority reaction to mental health education seems to be sort of groans and disengagement. Most of my peers talked about the mandatory mental health subject we had as basically like a free course that really just gave them a break from the really intensive rote learning subjects. This is, unfortunately, from my perspective, overall reflective of the somewhat derisive avoidance of talking about mental health that is fairly prominent in our society today. It's actually something I've learned quite a lot about through my volunteer work. As I'm sure you can imagine, I do have quite a bit of free time. I can't do proper work because I still so frequently have to go into hospital, so I find myself available to take on a lot of photographic sessions for Heartfelt. And when I started this work, I didn't know how passionate I would end up becoming about advocating for awareness. Stillbirth is a topic that, like mental illness, is not talked about enough. It carries a weight with it that makes it harder for those suffering that tragedy, and it often leaves them fighting without the social support and understanding that could benefit them the most. This talk isn't really about stillbirth predominantly or Heartfelt, but I would encourage anybody interested to look it up in your own time, because it is a very, very important topic that should be more well known. As a society, we just take a bit of a don't talk about the war attitude towards so many things that we need to offer our support to. I think predominantly because people just don't understand, and this attitude is something that demonstrates a societal expectation towards expression of emotions, about grief and trauma, and it's teaching people that their emotions can be wrong or right and need to be personally policed in order to fit in with everybody else's. All of this is sort of how I would define the kind of rigid thinking that leads to mental illness. Certainly, for me, most of my worst and most damaging personal habits within mental illness, they have developed through a desire to appear outwardly in control of my emotions. They've developed through a suspicion that I didn't handle my own trauma correctly, and I felt like that it made me a bad person. And it's only now at 27 and after a decade of therapy that I've started to think that perhaps I may not be the kind of person I always thought I was. But it's actually pretty hard to maintain that belief when you are actively told the complete opposite, especially when you're at a really, really vulnerable stage or state. There are times when I've been taken to hospital and told by a doctor, it's not worth our young doctor's time to treat your wounds, or your skin looks like shit and you'll probably be dead in 5 or 10 years anyway, so there's really no point in stitching up any of your wounds, so we're just going to leave them. Or anybody who actually wanted to get better wouldn't have needed treatment for as long as you have. So this type of statement in a vulnerable, particularly in a vulnerable state, but really in any state, can derail a lot of progress. It's an incredibly dehumanizing experience, and it can really easily have very, very dangerous consequences. Most often, these type of comments are something that accompanies the experience of trying to get medical attention for self-harm or medical treatment for eating disorders. It does also apply to other mental illnesses like bipolar disorder and schizophrenia, but I don't have personal experience with that, so that's not something I'm going to talk about much. I won't be referencing a lot in this speech. This type of prejudice, it's predominantly due to the massive amount of stigma and misinformation that exists about people with eating disorders and people living with self-harm. Both issues are really frequently labelled as choices by the general public and by healthcare professionals. It's a misnomer that allows people to dismiss our human rights and just treat us really quite badly, because they can simply say that this is what we wanted, this is how we chose to live. There are also very few options for treatment, so a lot of professionals, even if they really have the best intentions and do want to help, they're sort of in the dark as to where they can send patients to get the proper help. It may not be available, or it may be too costly. There's a lot of reasons behind that, and basically what I'm asking for at the moment, what I need from everybody who treats mental health, is to take some time to imagine how much mental pain and torture you would have to be in order to get to the point where harming your own body is a preferable option to an evening alone with your own thoughts or memories or flashbacks or anything like that. Because that's usually what it comes down to for me. Sometimes the experience of being inside my head, it's just so unbearable, and I can't get away from it. I can't get away from thoughts, memories, flashbacks, as I just mentioned. So even having to go to a hospital for a few hours of stitches, even though that's not really my intention, it's sort of preferable to having to deal with the flashbacks or the memories or my own head just yelling at me. Even if it's a bunch of stitches without lidocaine because doctors often refuse to administer it to self-harmers because they wrongly believe and will assert that we are just masochists and we really love pain anyway, so we can just deal with it. For me, even though I am technically choosing something, I'm not really choosing anything. My brain just sort of shuts down. I would explain it as something akin to the fight, flight, freeze response, and my brain reverts to methods that I've used in the past. I never really developed a healthy way to deal with such extreme emotions, and I guess I couldn't really tell you when it started for me. I know that I was doing it at a very young age, but it was very minor at that point. I kept it to myself and nobody really knew much about it. At the time, I felt so overwhelmed by everything. I wasn't sure how to calm myself down and focus on what I needed to focus on at the time. I didn't know then that I was also dealing with dissociations, which can be a symptom of complex PTSD and other mental disorders, but that's the only one I have experience with, so again, that's the only one I'm going to talk about. All I knew is that I couldn't ground myself in the present. I felt like I was stuck in the past and I didn't feel safe. I just felt really scared and I couldn't concentrate because my head was filled with so many distracting thoughts of trauma and fear and shame. My brain just looked a little bit like those the hoarders houses that you see on television with the piles of stuff everywhere and everything's in the wrong place and rubbish is piling up and nothing is organized, and I really just needed my head to be quiet and calm and tidy in order to deal with everyday things, even just like the most menial of tasks I just couldn't concentrate on. I started self-harming somehow and I really thought that it was helping me. Spoiler, it really wasn't. I mean, it may have been superficially, but it's in the long term it didn't help me at all. My head seemed to be neater and in order, and I could focus on what I needed to focus on without being as distracted. So my intention with self-harm, it was never to involve anybody else. I just wanted to be able to solve a problem on my own without needing anything from anyone. I wanted to feel independent and I didn't want to need anybody else's help. I didn't know then that the more I self-harmed and engaged with my eating disorder, the more I was refusing to acknowledge the grief that comes with trauma, and the more I was actually making myself much sicker. Though incredibly maladaptive, self-harm was my way of coping and had been for over a decade, and giving it up was never going to be easy. One of the amazing nurses I've had recently pointed out how much focus there is on an episode of self-harm as a screw-up and how little acknowledgement there is on making it through periods of time without reverting to it. The punishment aspect during treatment for an episode of self-harm, I think, can be much more detrimental than helpful, and this is doubly true if there isn't an attempt to place equal acknowledgement of the triumph of making it through the days or weeks or months prior to the episode of self-harm. So you really need to be congratulatory towards your patients, or if it's just you on your own, towards yourself. If you've made it for a week and usually you can't make it that long, then that's amazing and you've done a really good job. And self-harm, even when you're trying not to, it's a mistake, but you need to tell yourself that you can do it. You can make it without it. You have made it through difficult things without it in the past, and you will be able to in the future. You need to keep working on it. And that's also, nurses, what you need to tell your patients. You just need to embrace, nurses need to embrace, if they have the appropriate understanding of the complexities of such, to embrace the challenge of beating your last self-harm free record. One of the things that I've learned about myself through treatment is that I do not deal very well with boredom. I need to be working on something that's important to me, or else I start to experience increased anxiety and other symptoms from my assorted illnesses. This is predominantly why I began working on my book, Immeasurable. I had a passion for awareness, and I really felt I needed to do something. I wanted to explore the different experiences of eating disorders, and to give the courageous people that I had met through various treatment programs a chance to tell their story and to have a voice and to have their voices heard. But I wanted to create something that didn't have the same pitfalls that I'd seen in other explorations of eating disorders. To this end, I created a no numbers rule for the book, which applied to every person in it. This means that there is no mention of calories or weights within the book, as these are incredibly triggering to those of us with eating disorders. It's also important because the majority of society defines the severity of eating disorders by the weight of the individual, and this is not only completely incorrect, but it's a key reason why eating disorders are able to hide for so long and subsequently flourish in our society with dangerous and sadly often lethal results. So to create this book, I asked my participants to imagine a physical place which represented the psychological landscape of their minds while they were living with an eating disorder. I collaborated with each person to find a location that resonated with their experience, and I also asked each person to provide me with a handwritten statement that further explained their situation, gave any additional information that they wanted to share with people. The intention of Immeasurable is to let individuals speak for themselves, because I'm not telling one story but so many. And today, if I asked each one of you to think of a physical location that represents the landscape of your mind, what do you think that you would choose? Would you choose a dangerous cliff face, or a dark tunnel, or an open grave? Because these are some of the locations that my participants chose, and these locations represent our headspace every day for months, for years, and in some cases for decades. Imagine yourself living in those landscapes and you aren't able to get out. With your friends and family, maybe they can see you but they can't get you out, which is torturous for them in a whole different way. It's a terrifying landscape and nobody wants to be in it. But if you find yourself living there, it's reasonable that you would take fairly drastic action and do anything you could to get out. Because you don't go on a journey of self-destruction, of self-torture, and basically, to put it bluntly, a really slow suicide just to look pretty or to fit into smaller clothes. You do it because you're searching in vain for a path that leads you to a better, happier landscape, and at some point you, wrongly, came to believe that controlling your food and punishing your body might lead you there. And really, actually, is it any wonder? At some point, our society came to equate the consumption of food with poor morals and excess weight as a representation of weakness. Even just take a moment to reflect how much moral values are placed within food advertising. You see a lot of things like desserts that are described as sinfully delicious, or snacks that are labelled as guilt-free. This is wrong. It's horrific, it's damaging. People might dismiss my comments or my reaction to it as overreactions, but It's not. To attach a moral value to the consumption of food, it creates a horrifically dangerous mindset in which people come to define their entire being as good or bad based on their food choices. And maybe if you already think that you're a bad person and you're looking for a way to fix it, and it's really complicated and you don't know how, maybe you'll turn to something in your life that's really quite easy to change. So you could change what or how or when you eat, and think that it will turn you into the good person you want to be, because that's what you're always told about food anyway. But for some reason you still don't actually feel like a good person, so you change it more, because surely the reason is that you're just not doing enough, right? So you change it more and more and more, and so on and so on, until you're so far down the track of an eating disorder that you just can't turn back. And changing your food intake, it won't make you feel like a good person. You will, however, have a body that's now accustomed to eating disordered behaviors and a brain that doesn't receive enough nutrients to function properly. You'll also have an eating disordered voice, and I use that term loosely. Please don't confuse it with the sort of references to a schizophrenic voice. This is essentially just your inside your mind voice, I suppose. The eating disordered voice in your head essentially functions like a kidnapper, I suppose. It tells you what to do and promises a reward or an ability to avoid a punishment if you follow its rules. The reward never comes, just by the way. You will never get there. You will never get to be happy. The kidnapper demands secrecy, and this means that you're forced to wear a mask everywhere. You can get to the point where your own personality is just so enmeshed with the eating disorder that most people won't actually know what the real you is like anymore. The power and control of this kidnapper is immense, and the longer it is allowed power, the stronger it grows and spreads its roots out into your body and your brain until it's taken over everything. This is why early intervention is key, and proper intervention. There needs to be a vast increase in the amount of community support for mental health. The out-of-pocket cost is often too much to even be a possibility for a lot of people. In a lot of cases, people who don't have private health coverage simply don't get treatment due to the lack of available resources. And things are changing, definitely. People are starting to realise the seriousness of mental illness, but from my perspective, it's really not quickly enough. Out-of-pocket costs for eating disorders are estimated at $585 million in 2012. Eating disorders have the highest mortality rate of any mental illness, and 1 in 10 people with anorexia nervosa do not live more than 10 years after the onset of the disorder. Funeral costs for premature death caused by eating disorders is estimated at around $9 million per annum. For my part, I can attest that funeral costs might be financially calculable, but the emotional costs are infinite. It's difficult to look at statistics and imagine the faces behind the numbers, but I would like to talk about 5 women who were once part of my life, some of them closer than others, but all women that I cared for and respected. The names were Alana, Bonnie, Lisa, Christina, and Tamika. Of these 5 women, all of them had eating disorders. Of these 5 women, all of them fought for years, and of these 5 women, 4 were under 30. 3 of these women died due to suicide, 1 died due to kidney failure, 1 died due to heart failure, and these are just 5 women. Behind the mortality statistics, they were loved by thousands of people, and I don't think the cost of their loss can really be measured. The holes left behind when these people are torn from our lives is infinite, irreconcilable, and immeasurable. So my request to everybody today is multi-pronged. Firstly, I would ask that you do everything you can to look after yourselves. Accept peer supervision and support. It take time off when you need it, and turn down the double shifts if you're too exhausted. So many of our best nurses suffer from empathy burnout at some point in their careers and end up leaving nursing. Please don't let that happen to you, because we really need the good ones. The second thing I'm going to ask you is to try and imagine how desperate, how afraid, and how lonely you would feel if you were at the point that your patients are. Imagine what it would take to push you to that point and offer some understanding, some compassion, and some empathy to us. We really can't do it alone. We can't do it without you. When I graduated high school, I listed my favorite and defining quote as, if you can't be a good example, at least you can be a horrible warning. Today I'm trying to be both. Thank you.